In honor of Infertility Awareness Week, and as an advocate for holistically minded women's healthcare, I want to share an experience I recently had. I was originally writing about this with my intention to share it as a post, but I decided that I wanted to read it to you instead. Last week, I went to one of the big medical centers here in the Portland metro area for a preconception counseling appointment with an OB/GYN doctor. Now, as some of you may know, since I speak openly about my own wellness journey, I practice symptothermal-based fertility awareness method as a means of natural birth control and to stay attuned to my overall health. So I'm fortunate enough to know the ins and outs of my cycle very well. I've had my follicle-stimulating hormone levels tested twice in the past few years, with results higher than what is considered normal for my age, indicating that my ovary function may be compromised or that I could have premature ovarian aging. I've been working with a functional medicine doctor for over a year now to address and optimize my hormone and gut health, so I wanted to get my FSH levels retested to see if anything has shifted positively or negatively. When the doctor was going over the various tests she would order for me, I brought up my concern around my elevated FSH levels in the past. She responded to my concern with the statement, "Numbers don't really matter," then went on to say how she had her AMH levels, another fertility indicator, tested in between giving birth to her 2 children, how they were shit, and she was still able to give birth to a healthy baby, which is great for her, but that doesn't mean that would hold true for me. So that was mildly annoying to hear a medical professional basically say, "Oh, you don't need to know the science-driven data behind your body's health. It doesn't matter." And this is not the first time a doctor at this medical center has told me things of that nature, but that's for another time. So, at the end of the appointment, she asked if I had any other questions or concerns. I said yes. I had COVID last winter and still have some impaired circulation issues from my body fighting off the virus. I had COVID toes for several months and still have discoloration of my toes along with poor blood circulation to my toes from time to time. I know all of this is still so new, but are there any concerns for women who have had COVID to go through pregnancy? And she immediately disregarded that question and jumped to asking if I've gotten the vaccine yet. I said no, and she recommended I get vaccinated before trying to conceive, which I responded with, "Are there any concerns regarding fertility or child development related to the COVID vaccine?" She replied, "Oh no, none at all. Thousands of pregnant women have received the vaccine so far, and it's completely safe." Well, don't you just love it when a doctor lies straight to your face? There weren't any trials done on pregnant women before the FDA rushed authorization for the emergency use of the COVID vaccine. There is now a trial being conducted on pregnant women, but until those women who have vaccinated birth babies and then those babies grow up into healthy children, you cannot definitively say that the vaccine is safe in regards to those women's health issues. It's basic logic. I really hope it is safe, but with a lack of long-term studies, because the time-space continuum, you can't state that this vaccine is safe long-term in good faith. Now, I did not want to waste my time and energy on bringing up this very real point with this doctor, because frankly, I wanted to make sure I got my blood tests ordered and didn't want to do or say anything that could compromise that outcome. But her ending guilt trip was, "Wouldn't it be nice if we reached herd immunity before your baby was born?" Considering my body was fighting COVID for over a month, I very likely have long-term T-cell immunity and have probably been contributing to herd immunity since last March. The CDC clearly states on their website that it will require a combination of people who have recovered from COVID along with people who have been vaccinated to reach herd immunity. Whether or not someone decides to get the COVID vaccine is a personal choice that one should make from as well-informed and considered of a position as possible, and not just from a blanket recommendation that isn't based on scientific evidence. And there's a dark history of poor health recommendations for women. My greatest hope for sharing this experience with you is to raise awareness around the need to advocate for your own health as a woman in this world.